the whole team of Midterm RSSDI, where this diamete has gathered all of us, and especially Dr. Dinabandhu, who has been instrumental doing programs here. Give a big hand for the organizing committee before we go to the topic. I'll be very brief in the interest of time. Please cooperate with me, and I'll give you at the end a particular formula where each patient you can discuss and initiate with this. Before that, I'll take a review of the audience. How many of you feel that a newly reporting diabetic patient with atherosclerotic cardiovascular disease and obesity with existing cardiovascular and renal complications. Patient presented, we evaluated, we get ASCVD, we get early CKD or DKD, we get overweight or the obesity, at the same time dyslipidemia and hypertension. How many of you will agree to start the patient with a combination of GLP-1 receptor agonist, SGLT2 inhibitor and metformin, which intercept all the complications? Obviously the A1C is less than 9, but with all complications. Please raise your hand. Only 3. Only 3. So those who are updated about guideline, they are willing to do. Now it's a conventional practice as per the guideline. Whoever comes, we ask for lifestyle. इसमें नहीं हुआ तो फिर metformin. इसमें नहीं हुआ तो फिर go on adding sulfonylurea, gliptin, SGL2 inhibitor, 1 drug, 2 drug, 3 drug, 4 drug, 5 drug, 6 drug, and still the patient insists, give me more drug, I won't go for injectable. So you'll listen that in the course of time. I'll just tell you how scientifically you can be very alert at the same time saving patients money. You know about the diabetes burden, and you can see here the 537 million in 21 diabetes atlas is going to 783 million by 2045. That's the projection. And we all are moving to a volcano of diabetes, a tsunami of diabetes. In spite of all our efforts, we are moving towards a very revolutionary rise in the number. And this is the history, starting from insulin. You know the history of animal insulin, history of human insulin, to rapid analogs like Lispro, the basal analogs, glargine. And it was launched. Then came the first GLP-1. This two, you have a pointer? No, laser pointer? Okay, I'm telling here. Yeah, you see, the two important landmarks are this. The one is this, the launching of glargine. It was a pickless insulin, and 2000 it was launched. It became the most selling drug in the world, most selling drug. Not only in diabetology, in all segments. And the first launch of GLP-1 is exenatide. The Gila monster, those who are senior physicians will remember, this is from the salivary gland of the Gila monster. We found a drug which has incretin therapy. And incretin therapy means any drug delivered through GI, the calorie challenge delivered through the GI tract stimulates the insulin more than that of the IV route. So from rapid analog Lispro to the basal analog glargine to exenatide to daily liraglutide, then series of drugs, the dulaglutide, the semaglutide oral, the semaglutide injectable, the first asparts, they came. And you see here the holistic management targeted glycemic target, the cardiorenal protection and metabolic safety. And here you see the graph, here the graph, including the GLP, basal insulin, and the standard of care together. From ultra rapid insulin, the insulins at a glance, I'm telling you about the ultra rapid with a first absorption, rapid acting insulin, short acting, intermediate, long acting, ultra long, thus 300 U glargine or 200 U degludec with a weekly basal, a concept of icodec where it is delivered weekly. And even the weekly therapy has gained popular. This is just 4 drugs a month and you forget the complications. So the ultra rapid analog accelerated absorption insulin, this is what you see. The onset, the onset is almost 5 minutes earlier than to the conventional onset in this ultra rapid, and it is available now with us. And you see the faster aspart where it's almost 5 minutes onset before the conventional. There is a left shift, and this is the dosing flexibility with post-meal control, because one of the common pathology in the diabetes is delayed and blunted insulin secretion. That is ensured by this insulin, faster aspart. I'm now speaking of the newer insulins. You knew about the ultra-rapid analogs, and now it is the faster aspart. And here, the ultra-rapid Lispro, which is launched as Umjev, has again earlier peak of action. You can see here, against the standard rapid-acting insulin, we have postprandial glucose excursions are less, 1 hour and 2 hours, and hypoglycemic risk, though at par, the patient is comfortable with a flexible dosing. The evolution of basal insulin, NPH, all of you when you were undergraduate, the NPH was being taught, from NPH to glargine, from glargine to detamir, from detamir to glargine U300 and degludec has come, and this is virtually peakless, because peak was corresponding to hypoglycemia and trough was corresponding to hyperglycemia. We thought that it will go, maintain a steady and come down, and they are the best examples. Degludec is a multi-hexamer protraction breaking to monomers and dimers, and half-life of 25 hours, duration more than 42 hours, steady state 2 to 3 days with 4 times lower variability. See, less is the insulin variability, better is the glycemic control, which we detect with a CGM. You see the insulin glargine concentrated depot technology, and you can see here the flatter pattern. You see, this is what the previous, the basal insulins, it was going up and it was coming down. Here there was hypoglycemia, here there was hyperglycemia, but here it went up, maintained and came down in 24 hours. No hypoglycemia, no hyperglycemia. This is very steady state of glargine U300. And the degludec versus glargine U300, these are the trials, the bright, conclude and in range, and all support the long-acting insulin basal. The titration is shown here. We start either 10 units per day or 0.1 to 0.2 units per kg per day, and then target we keep 80 to 130, and the algorithm is shown here how you can increase 2 units or in hypoglycemia can decrease 10 to 20%. So weekly insulin is a very important trial, and SAB Medical College was part of the onwards trial where there is no headache, and it works just 52 injections per year, and it works very efficiently, reducing A1C and reducing the work. And you see instead of this fluctuation, this is Epsitora alpha, is fusion technology with a half-life of 17 days, and you see the level goes up, is maintained up to 14 days. This is day 14. It's a peakless, maintained for 14 days, and then this comes down. So the biosimilars like Glargine, Lispro and Aspart, the switching and conversion rules are there for those who are interested. But injection techniques and the site health and the hypoglycemia, I'm not going in detail. I'll come to the incretin pathology. So insulin, I have shown you the latest insulin and latest technology. Very swiftly in 5 minutes I'll finish up the incretin physiology and will end. The gut, pancreas, brain axis I told, the giving glucose by oral route decreases the body response, and there is good amount of insulin secretion. So this is the basic pathology where the GLP-1 receptor agonist has multi-organ mechanism starting from CNS, cardiovascular, GI, kidney, everything. And here the short-acting, long-acting, weekly, oral formulation, dual agonist, all GLP-1s are listed starting from exenatide, lixisenatide to liraglutide, dulaglutide to semaglutide and tirzepatide. And we have dual agonist which is effective. We have oral sema which is very effective in people reluctant for insulins. And these short-acting agents were first to be launched, which were given in the BD dose, the exenatide and lixisenatide. But lira was once in the leader trial, dulaglutide in the rewind trial, Susten 6 in the semaglutide trial, and the oral sema with snack technology revolutionized, and those who were reluctant took oral sema, lost good weight, lost good glycemic control. And GLP-1 cardiovascular benefit, the 3-point MSE, the fatal, non-fatal stroke, the myocardial infarction and heart failure, all risks, they came down. And the renal outcome, starting from leader, sustain, rewind, amplitude and flow, they came down. The weight, blood pressure and lipids all come down. And if you take TISA, there's a very significant reduction of up to 20% weight loss and 16% A1C. The SURPASS trial directly compares TISA and SHIMA, which shows maximum weight of 11.2 kilo reduction with 2.3% A1C drop and safety and tolerability at its best. See, patient selection, it needs to be obese with atherosclerotic cardiovascular disease and other comorbidities. And the dosing strategies is always graded in GLP-1. In semaglutide, we start with 0.25, go to 0.5, 1, 1.7 and 2.4. And tirzepatide, we start with 2.5, 5, the 7.5, the 10, the 12.5, and we continue with 15. So the combining GLP-1 with insulin or SGLT2 inhibitor is a very good method in a poorly controlled diabetic with obesity and atherosclerotic tirzepatide and get a good control. This shows the ADA-ESD 26 injectable algorithm where the prioritizing the organ protection by our GLP-1 receptor agonist, the efficiency of GLP-1 receptor agonist and the basal insulin combination has been clearly shown, and basal fast versus GLP-1 receptor agonist fast is a very good combination, and both are required, but you have to start basal insulin fast when the patient is symptomatic. There is polyuria, polydipsia or the weight loss, and there is severe hyperglycemia, A1C more than 10%. There is a catabolic state, ketosis or the muscle wasting, and the fasting driven high fasting plasma glucose dominant. You have to go for GLP-1 fast when there is atherosclerotic cardiovascular disease, obesity, postprandial hyperglycemia and hypoglycemia avoidance. So either of the thing you can start first. So the concept of starting insulin going for GLP or starting metformin going for insulin is no more there. And fixed ratio combinations are also available. Iglar, Lixi, the lixisenatide and the glargine, and then this also can be started with a fixed dose combination of both. So implementation in the week 0 to assessment, education, monitoring, the safety check, adherence and the dose optimization, outcome evaluation, the target metabolism, the partial response, and this is the order. Cost wise, if we'll see the very good reduction of hospitalization, renal function deterioration, as well as the CB event avoidance. And the final slide, this is my last slide before I end. Just four things I'll stress upon. The modern basal insulins, the second generation U300 IDEG ASP, the maybe basal or bolus or weekly icodec. They provide flatter, more stable profile with significantly reduced nocturnal hypoglycemia risk versus U100, and weekly formulation offer potential to improve therapeutic inertia and adherence. So let us remember the modern basals as well as the ultra fast acting insulins as the modern insulins, latest insulins. And in GLP-1 sector, beyond glycemic control, the cornerstone therapy for high risk patient, reducing major adverse cardiac events, stroke or MI, and preserve the renal function, potent weight loss adherence, the core pathophysiology, and adiposity related type 2 diabetes. So if you see a phenotype based approach, it treats the patient, not just A1C, and ASCVD and obesity, you have to prioritize the GLP-1 receptor agonist. And if you see the simplification strategy, the combos and the education are important. Consider fixed ratio combination of basal GLP-1 before complex prandial. So ladies and gentlemen, these are the references of my preparation. To conclude, we have analogs, we have best of the evolution in the insulin therapy, both in the bolus as well as the basal segment. In the GLP, from exenatide time, in almost 25 years, we have moved through the liraglutide, the semaglutide, the tirzepatide, and now the best thing is a combination of insulin along with GLP-1, where you answer the weight rise, answer the lipids, blood pressure, answer the A1C reduction, at the same time delaying the complications, both microvascular and macrovascular. So take time to talk to your patient, convince him or her regarding a injectable therapy. It can be basal fast, the insulin fast, or it can be a GLP fast, or a combination of both. But the feel of control and the well-being will encourage our patients and will boost the combination use of the latest in insulin and latest in GIP for the complications control and giving our patient a long-term healthy life. Thank you again for your attention, and I'll be happy to take up questions if any. Yeah. Sir, it's less than a month for semaglutide to go off patent. And once the semaglutide is off patent, you have 35 to 50% reduction of cost of therapy. A dozen of companies have now launched their SEMA, and very soon, on 21st of March, you will get 12 brands with half the cost of the present. And I am sure it will still go lower. Like empagliflozin became affordable, this will become affordable. So this is a good time for our patients to get drugs like semaglutide. Only, only. That's around 11,000 now, which will come to 3,500 in a month's time. Get ready for that. much more, and that reduces the cost of treatment of complications. Thank you. Thank you for the time.
So it is a proud moment to hear from Professor Ponda. So it is, I think, the motto of the RSSDI success. Then our next speaker is, next topic is non-pharmacological treatment of diabetes. The speaker is Dr. Santosh Kumar Swami. He is a dynamic clinician and physician. He was Honorary Secretary API 2019 to 22, Honorary Secretary CSCC DSI 2022 to 25, Honorary Secretary GSI 2023 to 25, Joint Secretary GSI 224 to 25, and so many more. So I request Dr. Swami to start his session.
Jai Jagannath. Thank you, Chairperson, for the kind introduction. So, for the sake of time, I will be completing in 10 to 12 minutes. So, name a disease. It will be hypertension, diabetes, stroke, cancer, or any GI disorder. The lifestyle modification, the diet, the exercise have a pivotal role in preventing and controlling the already having disease. So, and we will discussing for diabetes. Prevalence of diabetes is increasing, and inactive lifestyle, poor food habits, and ultimately obesity are the culprits. And lifestyle interventions are the first approach for effective management of diabetes. And non-pharmacological interventions like dietary intervention, physical activity, stress management, and sleep hygiene are important interventions for the control of diabetes. There are studies in the diabetes prevention program research group comparing lifestyle modification and metformin. Both are equally effective. Other NIH public assess the cumulative incidence of diabetes lower in metformin and lifestyle intervention, and the percentage is even more achieved, 58% lower incidence than in metformin group. So both the metformin and lifestyle are similarly effective, and lifestyle intervention was more effective. These are the various lifestyle intervention studies for the diabetes prevention. Name it as US diabetes prevention, Chinese study, Finnish diabetic prevention study, Indian diabetes prevention study. All of them have emphasized the role of weight reduction, increased fiber intake, decreasing simple sugar, and controlling the alcohol intake, and avoiding refined sugars as intervention for control of diabetes. Coming to the nutritional intervention, we can, for a diabetic patient, we can advise to consume cereals, pulses, vegetables, fruits, milk and milk products, meat, fish, egg, oil and sugar. The limit of sugar will be 1 TSF per day, and oil will be 1.5 tablespoon per day. And cereals and vegetables like gourd and green leafy vegetables are more advised, and fiber rich fruits are advised. So a right diabetic diet is essential to achieve the optimum glycemic control, and small frequent meals are always better. Fruits like with fiber like pomegranate, pears and apples are advisable. Artificial sweeteners are always to be avoided, and green leafy vegetables, gourd and fenugreek, which is one important component for insulin sensitivity, increasing the insulin sensitivity, will be advised. Deep and junk fruits should strictly be avoided. So the diabetic diet chart: in the early morning, some breakfast, and in the pre-lunch, some sprouted grains. In the lunch, maybe it fish curry and in the night with some chapatis having low glycemic index, and the total fat, calcium is well balanced. So what are the do's and don'ts for a diabetic patient? Don'ts are processing sugar, sugary drinks, white flour, trans fats. Do's are which are allowed are fruits and vegetables, whole grains, small frequent meals. So the medical nutrition therapy is one of the important intervention for achieving glycemic control that can be intervene at a primary prevention level, secondary and tertiary prevention. In the primary, we have to modify diet by so that we can delay diabetes and prevent the onset. In the secondary prevention, we can achieve the dietary control and reduce the complications. In the tertiary, still we can manage with the diabetic complications which are already in progress, that is cardiovascular and renal. So this is the steps involved in planning and implementation of the MNT. If a patient is referred for MNT referral, we have to plan a nutritional assessment and a diagnosis of the nutrition requirement will be calculated, and that nutrition therapy will be given and monitored and further evaluated. Finally, a documented nutrition plan will be made. Another diet is the Mediterranean diet, which is plant-based, having cancer and cardiovascular benefits, which have high amount of olive oil, vegetables, legumes, whole grains. It is also protective in women with GDM and in cardiovascular diseases. Physical activity. Physical activity refers a process which increases the energy expenditure above the baseline, and which should be a planned, structured, repetitive, and is performed with objective of improving fitness. We cannot advise overnight physical activity for a patient who is not used to it. That will be have to be structured and planned, and we have to verify if he is sustainable for that exercise or not. Physical activity improves the insulin sensitivity, decreases the cardiovascular risk factors, increases the physical fitness, decreases lipids, blood pressures, and also overall well-being. Exercise are the major pillars in diabetes management. If done properly, it has immense benefits. Aerobic and anaerobic exercise. Aerobic exercise like bicycling, running, treadmill, stair climbing, swimming, brisk walking, and aerobic dancing like Zumba are effective. Anaerobic or resistance exercise like bench press, biceps curl, triceps pull down, squatting, and abdominal crunches are advised. Football involves both an anaerobic and aerobic. Basketball also involves both, and sprinting. Aerobic exercise 30 to 60 minutes of moderate intensity is advised, at least 150 minutes per week, and that should be at least 3 days per week with no more than 2 consecutive days without exercise. And resistance exercise at least twice per week in the absence of contraindication is advised. So walk instead of driving whenever possible. Take the steps in space of escalator. Work in the garden. Plant some vegetables. Do some household works. Even washing utensils also have some benefit. Yoga also keeps your blood sugar level more stable. Swimming is the best exercise for the upper and lower half of the body. Strength training or anaerobic exercise 2 days per week is also advised. And if you are working in an office or stick to the chair from 7 to 8 hours, you should take a break every hour for 2 to 5 minutes. Benefit of exercise is that it improves the mood and also the sleep. Also improves the muscle strength and mass, lowers the blood sugar, lowers the cholesterol, maintains the body weight, improves the mental health, and the follow-up of a 2-year study has shown if you achieve 10 kg of weight loss, then 64% of the diabetes remission can be achieved. It reduces the heart rate, increases the muscle oxygen uptake, improves the ventricular function, reduces the blood pressure and modifies the lipid levels, decreases weight and BMI, improves the insulin sensitivity. Also improves the mental function, lowers the serum insulin level, improves the glucose transport and muscle glycogen synthesis. Improves the myocardial perfusion, which helps in cardiovascular performance, prevents ischemic reconditioning of the muscles. Contraindications are there, either complicated CAD, unstable angina, heart failure, retinopathy, renal failure, acute infection, high blood sugar, uncontrolled hypertension and complicated pregnancy are contraindication for physical activity program. Stress reduction is there. It is advisable to take the help of breathing exercise like pranayama, and in this CME we are having a good friend circle and frequent outings, so that indirectly reduces our anxiety and depression. De-addiction for smoking and alcohol. Sleep hygiene, at least 6 to 7 hours of uninterrupted sleep is necessary, and deeper stages of NREM sleep, that is stage 3 and 4, are more restorative. Surgery, bariatric surgery like sleeve gastrectomy, adjustable gastric band, Roux-en-Y gastric bypass and biliopancreatic diversion are some of the bariatric surgery to achieve weight loss and sugar control. And finally, the recommendation, 6 to 8 hours of sleep, diet like 5 to 10% of body weight loss is needed, avoidance of saturated fat and simple sugars, ample quantity of fiber is required, regular exercise, walking, swimming, dancing, Zumba, and at least 150 minutes per week. So for preventing diabetes, tips are: lose the extra weight, be more physically active, health, fibrous foods are required, healthy fats are required like cod liver oil and trans fat is avoided, skip the fatty diets and make healthier choices. Thank you.
We'll take one question only. Professor Swain, what is your take on our traditional food pokhada?
Sir, I
As
want
a diet- as a
want to
diet-
share a secret. In Puri, I used to keep that arwa chawal and ferment it for 2 to 3 days and take one glass before my OPD. In the OPD, busy OPD, if any patient irritates you, you will not feel irritated. That is the benefit.
So that reduces your anxiety. But what about the carbs?
Carbs, but it has so much of probiotics in the fermentation that helps anyway. Sir, that is a $1 million question, sir.
So in the Indian tradition, what I used
I
to
am a
know,
teetotaler, so I cannot so much focus on that.
yeah, if somebody is taking, let him restrict.
Yes, sir.
Because stopping suddenly alcohol also
If you are in a
deteriorates the
friend
patient.
circle, just learn to say no. So in place of 4 packs, you will come down to 2.
And
That will also
and
have the
about
control.
you told that arava pakhal.
Sir,
But what I think in diabetes, if you sell in nutshell the pudding,
sir, pakhal means only the fermented drinks, not the rice.
yeah.
Only the drinks which contain the probiotics and the fermentation product of the rice.
That's why you used to avoid 3 white poisons.
Yes.
One is sugar,
Sugar.
one is made from maida,
Yes, sir.
and third is arva chawal.
Right.
These are 3 white poisons which are. Thank you, sir.
But there was a study which says that this overnight fermented rice, decant it, pour in water, and with our traditional food like saga, bhaja, macha, body chura, this was very good. This was a complete diet, a balanced diet.
Sir, then the role of gut microbiota will come, and that way it will be having some effect on the glycemic control.
So, thank you, Professor Swain, for an enlightening talk. We close this session. Thank you.
Thank you.
Thank you so much. I thank all our guests and speakers, chairpersons, for this amazing session. And now I request all to gather in the memento area to receive their mementos. And I also thank our chairpersons for the cooperation. And chairpersons also should gather to collect their mementos. Please.
Hello everyone. I would like to invite esteemed guest of honors to the stage for the inaugural ceremony. I request our chief guest, Professor Dr. R.K. Goenka, Chairman, RSSDI, Odisha State Chapter. Our chief speaker, Professor Dr. Jayant Kumar Panda, immediate past Chairman, RSSDI. Our guest of honor, Dr. Umesh Chandra Satpathy, Literature and Playwright. Honorary Professor Dr. S.K. Bansal, Secretary, RSSDI, Odisha State Chapter. Dr. Sanjay Das, Chairman-elect, RSSDI, Odisha State Chapter. Dr. Sarach Chandra Singh, Chairman, Research and HOD of Department of Medicine, SRM MCH. Professor Dr. Krishnakar, Dean and Principal of SRM MCH Kalahandi. Dr. Hare Krishna Satpathy, CDMO and PH of Kalahandi District. Dr. Jagulal Agrawal, Organizing Chairman, RSSDI Midterm Conference, Odisha State Chapter, DIME 2026. And Dr. Dinabandhu Sahu, Organizing Secretary, RSSDI Midterm Conference, Odisha State Chapter, to the dais. Please everyone, come to the dais. Now we will be presenting and honoring Dr. Sarat Chandra, Madam Dr. Krishna Kara, Madam, Professor Dr. S.K. Bansal, Professor Dr. R.K. Goenka, Dr. Sanjay Das, Dr. Jayant Kumar Panda, Mr. Umesh Chandra Satpathy, Dr. Jagulal Agrawal, and Dr. Dinabandhu Sahu. Now I would request everyone to stand and start for the lamp lighting session.
गणनायकाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय
Play the Ganesh Bandana.
गणनायकाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि गणनायकाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि गणनायकाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि
Thank you. Thank you so much. Now asking all our dignitaries to reveal a portrait. Now that's a wonderful portrait made by our dear Dr. Dinabandhu Sahu sir. So amongst us, there is a polymath who is not only a doctor, but also a painter, an artist, a musician, and a wonderful actor. So a big round of applause for Dr. Dinabandhu Sahu sir. Now, carrying forward our program with all this positivity, with a beautiful musical performance by our team. Sangeet Parichalna by Guru Shri Yukta Madhusudan Maharana, Tabla by Guru Shri Yukta Sanjay Kumar Baliar Singh, Flute by Guru Shri Yukta Narendra Kumar Panda, Violin by Dr. Dinabandhu Sahu, Kumari Nivedita Behera, Shriman Shubrat Kumar Mallik. Kantha Sangeet Parichalna by Amla Nakyanshu Sahu, Shriman Sushri Lipsa Maharana, Sushri Nirupama Jena and Sushri Nandini Pari.
Hello.
वन्दे उत्कलजननी वन्दे उत्कलजननी जननी चारुहासमयी चारुभासमयी जननी 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 वन्दे उत्कल जननी वन्दे शरीरा तालतमाल सुशोभिततीरा सुप्रतटिनी कुलशिखर समीरा जननी 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 वन्दे उत्कल जननी वन्दे उत्कल जननी घन घन वन भूमि राजित अंगे नीलभूधर माला साजित रंगे कण कण मुखरित चारु विहंगे जननी 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 वन्दे उत्कल 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 जननी चारुहासमयी चारुभासमयी जननी 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 वन्दे उत्कल जननी वन्दे उत्कल जननी तपयोधि विभूत शरीरा तालतमाल सुशोभिततीरा सुप्रतटिनी कुलशिखर समीरा जननी 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 वन्दे उत्कल जननी वन्दे उत्कल जननी घन घन वन भूमि राजित अंगे नीलभूधर माला साजित रंगे कण कण मुखरित चारु विहंगे जननी 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 वन्दे उत्कल जननी वन्दे उत्कल जननी वन्दे
request everyone to be seated. Thank you, our musical team, for the wonderful performance. Now I request our Dr. Dinobandhu Sau, Organizing Secretary, to tell few words.
Good afternoon. Jai Ma Manikeshwari. Good afternoon all. Dignified guests on the dais, respected Chairman RSSDI, Chairman-elect RSSDI Odisha State Chapter, respected Chapter Secretary Dr. Bansal Sir, immediate past Chairman Dr. Jayant Kumar Panda, another distinct guest Dr. Umesh Chandra Satpathy Sir, our organizing chairman Dr. Jagulal Agrawal Sir, Principal of the Medical College, Dean and Principal Krishna Madam, and Dr. Sarath Chandra Singh, the HOD of the Department of Medicine. August delegates, esteemed chair, all the media brothers, pharma associates, I welcome all of you to today's conference on diabetes. We are truly privileged to have this opportunity to organize the midterm conference of Research Society for Studies of Diabetes in India in such a distant place at Bhavani, Patna. So for the first time, we are organizing the conference here with the available facilities, available venue, with blessings of Ma Manikeshwari and all my seniors, help from my colleagues. We formed an organizing body and unitedly we worked behind the event to have this function. So friends, you know the importance of diabetes in the society. It's now a global epidemic. To create awareness, we had a walkathon yesterday, and the whole scientific session is designed thoughtfully to cater the academic need of the practitioners who practice in diabetes. So I once again welcome all of you, and I am thankful to each one of the delegates, associates who are with the event. With praying Ma Manikeshwari, I conclude my talk. We are thankful to the governing council body, the members, those who are present with us, our chairman sir and other distinct members, to be with the vision to bring this diabetic conference here to educate, to dissipate knowledge on diabetes, not only the faculties, the specialists from different streams, but also the assistant surgeons, MBBS doctors, those who are working in the periphery. There is a background vision to give some knowledge, to share some knowledge, so that the doctors who are the first contact of the diabetic patient can serve the patient, can treat the patient in an effective way. Now I conclude my topic. I am thankful from my core of my heart. There are some technical glitches which is out of the control. I have tried to my level best in every aspect to give my personal vision, my personal effort, but everything is in His hand. What He desires, what He is desiring, it is happening. So be with the situation, be with the problem. Thank you all this much. Thank you all.
Thank you, sir. Thank you so much for sharing your vision with us. Now, moving forward, I would like to request Professor and Dr. R.K. Goenka, sir, RSSDI Chairman, Odisha State Chapter, to share some of his words with us.
Good afternoon, all the delegates, all the faculties, my friends, my seniors, and my juniors. About RSSDI, just I'll speak a few words. First of all, I'll congratulate Dinubandhu for his efforts to make this conference a grand success. Whatever hitch has happened, man proposes, God disposes. Man may try his level best, but all thy wishes is happening. So RSSDI is totally dedicated to dissipate education and research. That's the only aim of this organization. So among the education comes the awareness. So now diabetes is putting all its effort to create awareness among the society as well as among the doctors and the patients. The first thing we should learn that to our diabetic patients, we should not treat them as a patient. They are people with diabetes. We call this terminology PWD, people with diabetes. They are not diabetic patients. Because they are, within their body, they are holding a different environment, different condition. But they are not suffering from anything. If you don't take care of that condition, you are going to suffer from everything. So that's what you should dissipate. This knowledge is to be dissipated. This disease is more a preventable disease than a treatable disease. And with that, I thank the team organizing for inviting us to this forum, and to all the delegates, all the dignitaries, all the participants who have come here and made this conference success. Thank you.
Thank you. Thank you so much, sir. We truly appreciate your visionary words. Now, moving to the next, I would like to request Dr. S.K. Bansal, Secretary, RSSDI, Odisha State Chapter, to share his insight with us.
Pranam to all those dignitaries on the dais and as well as those off the dais. RSSDI stands for Research Society for Study of Diabetes in India. This is a very old society at national level. In our state has a state faculty which is also quite old. Our team has taken charge from April 2025. During this 1 year period, we have tried to disseminate the awareness of diabetes among general public and inculcate orientation on management of diabetes among practitioners and medical fraternity. We have conducted one mid-year academic seminar in Raurkela in June 2025, Odisha State Annual Conference in SCB Medical College, Cuttack in August 2025, and now one mid-year academic seminar or conference in Bhawanipatna. We regularly do health checkups, awareness of public through walk and several other activities. We have taken up a program for moving towards rural areas, and we have taken up one village, Chendipada, in the Angul district, and we will try to ensure all-round development of that area in awareness and management of diabetes as a supplement to government machinery, not as a competitor to them. And we will continue our efforts in this direction. I stop here. Thank you.
Thank you. Thank you, sir, for your valuable insights. Now, moving to the next, I would like to request Professor Dr. Jayant Kumar Panda, sir, Chief Speaker, Diamid, to share his insights.
जोठी कहिबार स्कोप बहुत कम सेठी मुख्य वक्ता हवा गोटे बहुत बड़ भूल कहीं आपन जानते मुख्य वक्ता माने लोक आशा करते ये मिनिमम अध घंटा कहे आमको हसैबे खेलेबे खुशी करेंगे आउ एम्यूज करके छाड़े किंतु मते ऑर्गेनाइजर्स 5 मिनट टाइम देइथिले आ मो परिवर्तित सिचुएशन जो देखिली आमर रेस्पेक्टेड चेयरमैन सर 2 मिनिट रे सीमित करछंती ता मु निहाती भाव में ताको सही 2 मिनिट ही रखिपारि कहीं मोर भी सही 5 मिनिट टाइम थिला तो अपन जो मानक देखुं स्टेज रे दे आर हुज हु ऑफ डायबिटीज नॉट ओनली इन द स्टेट बट इन द कंट्री डॉक्टर रमेश गोयंका RSSDI रो इंसेप्शन रो सेठी एसोसिएटेड अछंती RSSDI इज प्राउड जे वर्तमान तांको चेयरमैनशिप अच्छी गोटे बड़ करताली दिंतु आज चीफ गेस्ट डॉक्टर रमेश गोयंका सी एब्सोल्यूट डायबिटीज कमिटेड आउ डायबिटीज रोगी देखती आमर स्टेट चैप्टर रो अकाउंट्स कहतु GST कहतु एक्टिविटीज कहतु तांको लीडरशिप रे एबे सब परफेक्ट थाए डॉक्टर संजय दास तांकोठु दायित्व नेबे आउ किछि मास परे सी भी कमिटेड डायबेटोलॉजिस्ट आउ डॉक्टर संदीप देवाशीष मिश्र द टॉल मैन इन द फर्स्ट रो सी तापर लाइन हो गले तो मु दायित्व देइथिली रमेश सर को रमेश सर देवे संजय सर को संजय सर देवे संदीप सर को ये जो लिगेसी जोटा आम ट्रांसफर करुचे दैट इज फॉर द कॉज ऑफ फाइटिंग डायबिटीज इन द स्टेट ऑफ ओडिशा आमे आमर प्रत्येक चेष्टा दौचे जे आमर प्रत्येक रोगी को डायबिटीज कॉज को आमे साहाय्य करवा डॉक्टर सत्यन कर अच्छा फ्लोर रे आम ट्रेजरर आउ एठी जो मान को देखुं गेस्ट आमर उमेश शतपथी स्पेशली बहुत जन तांको विषय जान नथिबे मु सुनिची कहीं एठू अनेक तांको छात्र ही इज ए टीचर ऑफ टीचर्स एंड ए क्रिएटर आपन देखंतु दीनबंधु को से म्यूजिक बजेले यही चित्र काटिचंती शोभनीय देखिए तांको कलाकृति ये जो ऑर्गेनाइजेशन सच ए मल्टीफेसेटेड पर्सनालिटी यांकु जी ग्रूम करिसेंती ही हैज टू बी ए परफेक्ट टीचर परफेक्ट गुरुजी तो उमेश शतपथी को गोटे करताली दे आप निमंत्रण करंतु सी आम डाक्तर मान गहन रे जड़े विद्वान जी आम समस्त को आशीर्वाद करने आज ये अच्छा आउ जगुलाल सर और दीनबंधु जोड़ी विषय में किसी कहबिनी मोर जड़े टीचर वेल विशर्स आउ आशीर्वाद करवा माने पर्सनालिटी ये अच्छा कृष्णा मैडम सी आम डीन अच्छा SRM MCH रो आउ मैडम को लीडरशिप रे एबे नुआ हॉस्पिटल बिल्डिंग अति शीघ्र आरंभ हो आपन देखुचंती कैंसर बिल्डिंग आउ मेडिकल वार्ड्स आउ पीपल आर शो डिसिप्लिन आपन जो देखुचंती एठी इंटर्न्स आउ मेडिकल स्टूडेंट्स काली जो वॉक रे जाइथिले टीम सब मैडम को लीडरशिप रे मोर काली सौभाग्य होइथिला मो SRM को जाइथिली सच ए क्लीन कैंपस मो भारत बाहर देखी ड्रेसडेन रे देखी सिडनी रे देखी ऑर्लियन न्यू ऑर्लियंस रे देखी किंतु भवानीपाटना रे एते सुंदर कैंपस एते ऑर्गेनाइज्ड क्वार्टर्स स्टूडेंट्स प्लेइंग लॉट ऑफ फिजिकल एक्टिविटीज तो गोटे बड़ करताली दिंतु डीन मैडम को जी कटक रे निज परिवार घर छाड़ी आसी एठी मेडिकल एजुकेशन आउ स्प्रेडिंग ऑफ द नॉलेज आउ अवेयरनेस पई एथिके एफर्ट्स देइचंती प्रोफेसर कृष्णा कर मैडम आउ शरद सिंह सर तो मोर गोटे बंधु आम मिसिकी मेडिकल जॉइन करथिलु से HOD मेडिसिन हिसाब रे दायित्व नहीं आउ से सेठी जो पेशेंट केयर को एते ऊपर को नहीं जाती मते कटक रे पेशेंट फोन करी कहती जे आमे सर शरद सर को चिकित्सा अच्छु आप कहीदेवे सर आमको टिके भल कि देखिए मुझे सर न कहले भी भल कि देखिए कहवा दरकार नहीं तो ये जो टीम आप देखुंट डॉक्टर सुरेश बंसल जहाँ को शुणिले आमर कमिटेड सेक्रेटरी गोयंका सर, संजय सर, कृष्णा मैडम, शरद सर, संदीप और सत्यन, उमेश सर, जगु सर और दीनबंधु सर और बहु जन को मु ऑडियंस रे देखुची, मालती मैडम, गौरी मैडम, आमर पीके सर, सो दीपक सर, श्रीकांत, संतोष, एंड दे आर ऑल पैक्ड। आ मु निश्चित से माने शह शह पेशेंट कर अपॉइंटमेंट कैंसल करिकी आज यही आलोचन रे भाग नापी आपण पाखे अच्छा गोटे बड़ करताली दिंतु। एथिरे मोर भाषणर आवार सरी जाइछि आउ गोटे कथा कहीकि मो मोर वक्तव्य को विश्राम देवी। पचारि आपण मानकु डायबिटीज रो समाधान पई आपणकर दुस्थ डायबिटीज रोगीटी को कॉम्प्लिकेशन फ्री करिवा पई, नुआ लोक मानकु डायबिटीज न होबा पई प्रेरणा देवा पई आपण माने प्रतिश्रुतिबद्ध तो जो माने भाबुचंती संतोष भाव रे काम करि परचंती हाथ टेकंतु। गुड नंबर कहीं आम डायबिटीज विषय आग्रही लोक एठी अच्छे आम चेष्टा करुचे। मोर शेष पदक अनुरोध यही जो आप देखुं डायबिटीज रोगी बढ़ी चलती तापाई आमर सर्वश्रेष्ठ प्रचेष्टा रोगीटी को एजुकेट करने डायबिटीज सचेतनता आम समाज रे सृष्टि करने बटिका रे इन्सुलिन रे इन्वेस्टिगेशन रे लेटेस्ट जिनस शिखी आमे जेकोसी स्पेशलिटी रे थाऊ किंतु डायबिटीज आम गोटे समस्या हो पारे। आमको अपडेट रखिबा, रोगी को अपडेट रखिबा, डायबिटीज विरुद्ध रे संग्राम करिबा जेमिति डायबिटीज राजधानी नुहे डायबिटीज चिकित्सार राजधानी भाव में भारत विश्व रे आदृत हब। धन्यवाद।
Thank you so much, sir. Thank you for your glorious words. बहुत बहुत धन्यवाद. Moving to the next, I would like to request Dr. Sanjay Das, sir, Chairman-elect RSSDI Odisha State Chapter, to share his words with us.
So, esteemed guests on the dais, my fellow delegates, colleagues of the dais, good afternoon to you all. I, being the scientific chairman of this conference, when I sat with Dr. Dinabandhu, we decided that we should have a platter of topics where it should cover all topics from inception to complication. In fact, before inception, pre-diabetes also. So as you could have seen, the array of topics, whatever we have selected, it covers most of the topics, including lifestyle management. So I am sure all of you, whoever has come here to attend this, behind their busy schedule, you are here, so we are thankful to you all. And diabetes management can only be possible if all of us are together in this noble thing. Besides, I can also tell you that this comprehensive management of diabetes, whatever is the theme of this today's Diabetes Diamede 26, is actually what, when we were a student, diabetes meant what? A number. We have to reduce the number. But what is now? It is comprehensive, multidisciplinary approach, and we have selected all those topics. And I'm sure today's deliberation, you all will be very happy and knowledgeable, and ultimately it is going to help all our patients. Thank you all.
Thank you, sir. Thank you for such thought-provoking words. Now I would like to request Dr. Umesh Chandra Satpathy, sir, literature and playwright, to share his words with us. Huge rounds of applause.
Humble pranam at the lotus feet of Bhagavan. My sincere gratitude with a humble attitude to all the doctors of this country. When I got the invitation, I was really scared of it. I was frightened. Only my single question was there, how to go and meet all the brilliant nation builders. I never got such opportunity. This is the rarest of the rare opportunity. The door made it open by Dinabandhu sir. So I extend my heartfelt thanks. While entering here, I listened Professor Dr. Jayant Kumar Pandaji all about the injecting diabetics and all. I got such a fantastic classroom here. I felt myself as if I'm in the Harvard University and listening the speech of the brilliant teachers. In that way, I enjoyed it. Next, I have enjoyed the class of Swai sir, Dr. Swai sir. After reaching here first, the gentleman met me, that is Dr. Ravi Senapati. The way he introduced me, then immediately my fearness reduces to zero. He told his Dr. Umesh Satpathy, he is the son of my teacher, Pandit Prabhakar Satpathy. Then immediately one great lady was standing there, she slowly came out and told, "Sir, I am Dr. Alisha Hussain, medicine specialist. I am your student, sir." Then it came to minus point that my fear is already vanished. She is here. Then I met by all the students here, maximum students, and here also Dr. Jagu Agrawal sir is here, the brilliant doctor. He is our parent. So I am seriously now comfortable. Please come out as a teacher. Professor Jayanta sir told one word, Umesh sir will give blessings. Yeah, a beautiful word that will be kept in my mind. It will be ringing in my mind till my death, that I have no power to give blessings to anybody else. Only this much I am standing here before everybody to only extend my gratitude. John Franklin Kennedy, once he told it after taking the oath. The whole world was witnessing it, what John Franklin Kennedy is going to speak. Entire world was watching it. The first word came here, fellow Americans, ask not what your country can contribute to you. Ask what you are going to contribute to your own country. That's why you all are silent soldier of our country. You are the silent soldier and you are the brigadier, and you are working round the clock, day in and day out. Day in and day out you have been working. You might be thinking, all the doctors, most probably the country is not giving us respect. No sir. All the people of the country is saluting to you, to your service. And once you salute your duty, no need to salute anybody else. If you pollute your duty, you have to salute everybody, everybody and everybody. You have been donating your most precious time. You are always remaining away from your family members and giving the service for the people, those who are crying, those who are having the pain, those who are having the heart attacks. You are the only gentleman regularly listening about the pain, nothing else. Everybody is coming before you with a tearful eyes and speaking all about and ventilating all about the body, and you are the person to give it the service, and service to mankind, service to God. And the Vaidya, the Veda, the Vidya and the Vaidya, the three people are the pious people of the country that don't have any interest other than saving the life. In between the life and death, it is the doctor who is to stand it, and it is the doctor who is to heal it, and it is the doctor who is to bring you out from that particular problem. So with the tearful eyes, I salute every doctor. Please, the whole country is eagerly waiting that to get your service, nothing else. And one last word, Professor Jayanta Panda sir told. He gave me 2 chocolates. And I kept it on my pocket. I felt it like a small boy, a innocent child. He told, "Sir, whenever you will come to Cuttack, please pay visit to my office and all." So I am very much thankful to everybody. Please, do or die, don't ask why. Do or die, don't ask why. And your job is 24 hours. We are working somewhere else in 6 hours, some are working 8 hours, and every day, every people are taking lavishly the CL, the EL and all. but doctors, they don't have it. By putting their life in danger, they serve for the country. Please keep it in the mind. You are at par the level of a soldier, those who are sacrificing their life every day. You are giving your soft hides, and please give a passion for that. Don't take this is your profession. This is purely a mission and passion. Once Mother Teresa was working with the leprosy patient, one gentleman was standing and watching it. He told it, had it been given to me 1 crore of rupees, I would not have touched a lepra patient. Then very gently, very politely, very softly, mother replied it, yeah, I too also don't, I'm not working only for money. It is the clarion call of God. I'm serving the humanity, humanity and humanity. Thanking you all.
Thank you so much, sir. Thank you so much. We are truly blessed to have you on stage, and we are truly blessed to have your words amongst us, and we'll take that as a true inspiration. Now, moving to the next, I would like to request Professor Dr. Krishnakar ma'am, Dean and Principal, SRM MCH Kalahandi, to share her words with us. Huge rounds of applause.
Respected dignitaries on the dais, the RSSDI chairman, the secretary of Odisha state branch, and also the immediate past chairman, Professor Jayanta Panda. He is very well known to me for the last 3 decades. And also the organizing team, the organizing chairperson and the organizing secretary, and all the dignitaries. Already sir has told, Umesh Satpathy sir has told many things, and my HOD. And it is a great pleasure on my part to be here on the inaugural function of the Midterm Conference of RSSDI. This being organized here at Bhabanipatna for the first time. So we are very happy to have this such type of conference here, and all of the participants, they have also will be updated their scientific knowledge and skill with this such type of discussion. And my time was 2 minutes, and now I have to also reduce it probably for 1 minute, and I have to tell only little bit. Already our secretary was sitting, Dr. Bansal sir has shared with me that he is doing a very good thing, that he is visiting the schools and also making the school children aware how to prevent diabetes about the and he is taking steps by seeing the weight of the children. So very important 3 things for diabetes is diabetes prevention by health promotional measures and prevention. Then next come the early diagnosis and treatment, and third is the research activity, and the name of RSSDI is there for the research activity, and they are also doing the many research. So very important is awareness generation to our children and young adults, because diabetes prevalence is gradually increasing and we have to catch them early. Promote the healthy lifestyle. As doctors, we have to promote the healthy lifestyle among the children, and many of our adolescents and young adults are getting diabetes, and diabetes prevalence is shifting to the left. So we have to take care of it. Early diagnosis, proper treatment, follow-up care to prevent the progression of complications, and third is the research activity. So I also request the all the dignitaries of RSSDI to have research activity here also, specifically among the tribal people. The prevalence of diabetes among the tribal people, and tribal versus rural people, and whether it is at par or it is less, and what is their food habit, and how we can halt the progression of increased occurrence of diabetes in this area, if at all, and also among the young adults. This study among the young adults specifically, and hope this RSSDI midterm conference will be helpful to all in generating the and improving the knowledge and skill, and long live RSSDI. Thank you all.
Thank you so much, ma'am, not only for your top tier leadership, but also for your words. Now, moving forward, we'll be having felicitation ceremony for our senior most faculties and professors. Stay tuned.
Now I would like to call our esteemed personality in the field of health services, Dr. Harish Chandra Pradhan, Senior Consultant Physician, Kalahandi District. Respected sir, we take immense pleasure and pride in felicitating a revered and senior most consultant physician whose lifelong dedication to the field of medicine, particularly diabetes care, stands as a beacon of inspiration for the medical community. Over the decades, your untiring involvement, clinical acumen, and compassionate service have touched innumerable lives. With unwavering commitment, you have combined the science of medicine with the art of healing, guiding patients with wisdom, empathy, and ethical practice. Your contributions have not only advanced clinical care, but have also nurtured a generation of physicians through your mentorship, experience, and example. Your steadfast devotion to understanding, managing, and educating others about diabetes has played a significant role in strengthening awareness and improving patient outcomes. Even though demanding times, your enthusiasm for learning, teaching, and service has remained undiminished, reflecting a rare blend of dedication, humility, and professional excellence. Today, we honor not just your achievements, but the values you represent: perseverance, compassion, scholarship, and selfless service to humanity. Your life's work continues to inspire us to strive for higher standards in both medicine and life. With profound respect and gratitude, we offer these felicitations and convey our heartfelt wishes for your continued good health, happiness, and enduring guidance to the medical fraternity. With highest regards and admirations, our organizing committee, RSSDI Odisha State Chapter Midterm Conference, DIME 2023.
Hello. Respected organizing members and office bearers of the Research Society of Study of Diabetes in India, Odisha State Chapter, distinguished members of the medical fraternity, esteemed colleagues, honored guests, ladies and gentlemen, Namaskar. I stand before you today with a heart full of gratitude and humility that words alone cannot express. When I was informed that RSSDI Odisha State Chapter has chosen to facilitate me for my years of service, I found myself looking back over the decades, not of my only achievements, but at faces of the patients who shaped me, the mentors who guided me, and the community that sustained me. Whatever I have accomplished in my career, I owe to them. This honor, therefore, belongs as much to them as it does to me. The land I call home. Many of you in this gathering may know Kalahandi through headlines and statistics, stories of drought, hardship of a district that once became a byword for deprivation. But allow me to share with you the Kalahandi that I know, the Kalahandi that I have called home for the whole of my professional life, that extends to a 50 years, half a century. I repeat, half a century I was in Kalahandi serving the underprivileged people. It is a land of extraordinary white beauty, rolling hills, carpeted in green, dense sal forests that stretch to horizon, rivers like Tel and the Indravati that went through valleys with timeless grace. The people of Kalahandi are resilient, warm, and deeply rooted in their traditions. They are people of immense dignity, even in the face of adversity. But Kalahandi has also endured great challenges. Poverty, food insecurity, limited infrastructure have been in constant companion for generations. Healthcare facilities, particularly specialist care, remain scarce. The nearest tertiary hospital can be hours away by road, and for many families that journey is simply not possible. In such a place, a doctor does not merely practice medicine, he becomes a neighbor, a counselor, a confidant, and very often the last line of hope for an entire community. I chose to spend my entire career in Kalahandi. There were times when the work was difficult, when resources were scarce, when the sheer scale of need felt overwhelming. But I can tell you with absolute sincerity, it is Kalahandi that has given me far more than I could ever give it in return. Every patient who trusted me with their life, every family that opened their door to me in a moment of crisis, every child whose recovery remind me why I became a doctor. In the first place, they are the reason I stand before you today. The teacher who saved my life. If Kalahandi gave me my purpose, it is my years at SCB Medical College during 1975 to 77 under the mentorship of Professor B.B. Tripathi, the iconic figure in diabetes in India. I was working under him, under his guidance. I was in charge of diabetic clinic from 1975 to 77. Professor Tripathi sir had the Department of Medicine at SCB Medical College and was widely regarded as one of the finest physicians in the field of diabetes that this country has ever produced. Anyway, that's all. I will congratulate Dr. Sahu to honor me on this special occasion in the presence of all the RSSI dignitaries present in this auditorium. Thank you.
Thank you, sir. Thank you.
Thank you so much, sir. This is an absolute honor to have you amongst us and having your felicitation on this stage. Now, I would like to declare the felicitation of esteemed personality in the field of health services, Dr. Kabiraj Chaudhary, Senior Consultant Physician of Kalahandi District. Respected sir, we are deeply honored to felicitate a distinguished senior medicine specialist in recognition of a lifetime of brilliant, dedicated, and continually updated service to patients in the fields of diabetes and general medicine. Throughout an illustrious career spanning decades, you have exemplified the highest standards of clinical excellence and combining profound medical knowledge with a compassionate approach to patient care. Your unwavering commitment to staying abreast of evolving scientific advances and translating them into practical, evidence-based treatment has greatly benefited countless individuals and families. Your tireless service, ethical practice, and keen clinical insight have made a lasting impact on the management of diabetes and general medical disorders, while your dedication to holistic care has upheld the true spirit of the medical profession. You have not only healed patients, but have also inspired colleagues and your younger physicians through your wisdom, humility, and professionalism. Today, we acknowledge with admiration your lifelong contribution to healthcare and your relentless pursuit of excellence in medicine. Your work stands as a shining example of service, scholarship, and humanity. With profound respect and gratitude, we offer the felicitation and convey our heartfelt wishes for your continued good health, happiness, and many more years of inspiration to the medical fraternity. With highest esteem and warm regards.
Respected dignitaries in the dais and the audience, I am very much thankful to RSSDI for recognizing my contribution to the peoples of Kalahandi. I am a son of Kalahandi. Since 1984, I am serving the people of this district. Thank you all.
Thank you, sir. Thank you so much, sir. It's such an honor having you amongst us. Now, moving to the next, we are having an appreciation of mementos of our dignitaries. We would like to announce the appreciation of Professor and Dr. R.K. Goenka, sir. Huge rounds of applause.
Now I would like to say some words about Dr. Ramesh Kumar Goenka, sir. Under your able guidance, the association has witnessed remarkable academic vibrancy, organizational strength, and a renewed sense of purpose in advancing diabetes care across the country. Your vision has not only fostered scientific excellence, but has also encouraged meaningful collaborations among clinicians, researchers, and healthcare professionals. The initiatives undertaken during your tenure have significantly contributed to improving awareness, education, and evidence-based management of diabetes, ultimately benefiting both practitioners and patients alike. We extend our heartfelt gratitude for your exemplary leadership and convey our best wishes for your continued success, sir, good health, and many more achievements in the service of medicine and humanity. Thank you. And now, I would like to appreciate and like to forward the memento to Dr. Jayant Kumar Panda. Thank you. And for Jayant Kumar Panda, sir, we remain deeply grateful for your invaluable service and continued support to the association even beyond your tenure. We extend our sincere good health and many more achievements in the years ahead. And now for Dr. S.K. Bansal, sir. Sir, some small words. Your ability to coordinate, guide, and facilitate diverse responsibilities with precision and professionalism has greatly contributed to success of various programs and meetings. The consistency, discipline, and clarity bring to the organizational framework have helped RSSDI grow with renewed efficiency and purpose. With heartfelt thanks, we extend our best wishes for your continued health, happiness, and many more years of meaningful contribution to RSSDI and the medical community. Thank you, sir.
Now I would like to invite Dr. Sanjay Das, an esteemed personality in the field of medical education and health services. We would like to express our heartfelt appreciation for your outstanding academic guidance and meticulous supervision in the shaping in the RSSDI academic meets. We convey our sincere gratitude for your invaluable contributions and extend our best wishes for your continued success, good health, and many more achievements in strengthening academic research. Now I would like to invite Dr. Umesh Chandra Satpathy, literature and playwright. So please.
Give a big hand. The teacher of teachers, Dr. Shatpathy, leads the intellectual mass of Bhawanipatna. And on behalf of SCB Medical College, Cuttack community, it's my privilege to felicitate sir with a small Uttariya.
Now I would like to invite Professor Dr. Krishnakar, Dean and Principal of our SMR MCH Kalahandi. Now I would like to invite Professor Dr. Saraj Chandra Singh, Chairman, Reception Committee and HOD Department of Medicine. As a Fine, quota.
Before we close the felicitation, I had a very pleasant job. We have 3 people who are at the helm of RSSDI. President RSSDI, President-elect RSSDI, and President-elect RSSDI. So on behalf of the team Cuttack and the SCB team, it's a privilege felicitating all 3. I request Dr. Sandeep to You come here, come here, come here. All 3. All 3 leaders. Yeah. Photo.
So there is a appreciation memento for our Chairman-elect 2026, Dr. Sandeep Devashish Mishra. Please bring his appreciation memento. Dr. Sandeep Devashish Mishra.
Wide angle.
Also, we invite our treasurer, Dr. Satyanarayan Kar. He has to come to the dais. Please bring appreciation memento for Dr. Kar also.
Dr. Satyan Kar. He is instrumental in handling all our account and funds. And you know,
Sir, please.
account is very important before any event. So, big hand for Dr. Satyan Kar.
Thank you, sir. Please. Now, just a minute, sir. Now, before going to end the inaugural session, I would like to invite the musical team, Guru Madhusudan Maharana, who has done the Sangeet Paricharana, and all the artist friends, artist guys and girls, please come to the dais. Just to give that one page letter. Announce to who are the members of the musical team. What is that? One page report. Please come. Musical team ro kagaz kahi. Okay, I want to let us introduce, sir. Please introduce yourself. Guru, he is my guru who taught me how to play the violin. My beloved guru, Madhusudan Maharana. Yourself, sir. Sanjay Vyas.
Narendra Kumar Panda.
The finest flutist of Bhavani Patna, Mr. Narendra Panda.
Nirupama Jena.
He is one of the ANM student. Next.
Nivedita Behera.
He is working in the secretariat.
Nandini Padhi.
Okay. One of the fine singer of the Bhavani Patna, she is Lipsa.
Lipsa Maharana.
Myself Subrat Kumar Malik from Kotak. I am a MLU student, second year plus student.
So finally, he has to introduce himself. Please introduce.
I am Amlan Akhyangshu Sahu, son of Dr. Dinabandhu Sahu, and I am a final year MBBS student studying in Bhimabhoi Medical College and Hospital, Balangir.
Thank you. So please. Sir, will you like to tell few words, one or two sentences?
ମୁଁ କ'ଣ କହିବି ଆଜ୍ଞା ଆପଣମାନଙ୍କୁ ଏ ଆପଣଙ୍କ କଲିଗ୍ସ ଯିଏ ଏତେ ଦୂର ଆସି ପହଞ୍ଚିଛନ୍ତି ପାଖରେ ମୋର କଟକରେ ଥରେ ଗୋଟେ ଇଣ୍ଟରନ୍ୟାସନାଲ୍ ଆର୍ଟ ଫେଷ୍ଟିଭାଲ୍ ଥିଲା ସେଥିରେ ସାହୁବାବୁଙ୍କ ସାଙ୍ଗରେ ମୋର ପରିଚୟ ହେଇଗଲା ତାପରେ ସେ ବାଧ୍ୟ କଲେ ଯେ ମୁଁ ଏତେ ଦିନରୁ ଭାଇଲିନ୍ ଶିଖୁଛି କିନ୍ତୁ ମୁଁ କିଛି ପାଇପାରିନି ଆଉ ନିହାତି ମୋତେ ଦରକାର ଏ କଥା କହିବା ପରେ ମୁଁ କହିଲି ଆଜ୍ଞା ଏଇଟା ସମ୍ଭବ ନୁହଁ କଟକ କାହିଁ ଭବାନୀପାଟଣା କାହିଁ ମୁଁ ଏଠି ମୁକୁନ୍ଦ ରେଡ୍ଡି ଆର୍ଟିଷ୍ଟଙ୍କର ଯେଉଁ ପିଲାମାନଙ୍କ ଚିଲଡ୍ରେନ୍ ଆର୍ଟ କମ୍ପିଟିସନ୍ ହୁଏ ସେଥିରେ ଥରେ ମୁଁ ସମ୍ମାନିତ ହେବା ପାଇଁକା ଆସିଥିଲି ଆଜ୍ଞା ଆଗରୁ ଭବାନୀପାଟଣା ଦେଖିଥିଲି ତେଣୁ ଏତେ ସୁଦୂର କଟକରୁ ଇଏ ଜଗତପୁରରୁ ଏଠିକି ଭବାନୀପାଟଣା ଆସିବା ଯେଉଁ ବହୁତ ଡିଫିକଲ୍ଟ ମୁଁ କହିଲି ଆଜ୍ଞା ସମ୍ଭବ ନୁହଁ ଆପଣଙ୍କ ସାଙ୍ଗରେ ମୋର କୌଣସି ସମ୍ପର୍କ ହେଇପାରିବନି ନା 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 ମୁଁ ଟିକେ ଜାଣିବାକୁ ଚାହୁଁଛି କହିଲେ ଆପଣ ଘର କେଉଁଠି ମୁଁ କହିଲି ଜଗତପୁରରେ ନା ଆମେ ତ ଏସ୍ସିବିରେ ପାଠ ପଢ଼ିଲା ବେଳେ ଆମେ ଚୌଦ୍ୱାର ଯାଉ ବୁଲିବା ପାଇଁକା ତେବେ ଜଗତପୁର ତ ବାଟରେ ମୁଁ ଏ କଥା କହିବାର 3 ଦିନ ପରେ ପରେ ଆଜ୍ଞା ଯାଇ ପହଞ୍ଚିଗଲେ ସାହୁ ବାବୁ ତାପରେ ଶିକ୍ଷା ଆରମ୍ଭ ହେଲା ପୁଣି ପୁନର୍ବାର ଆପଣମାନଙ୍କୁ ଭାଗ୍ୟ ଥିବା ଆପଣ ଚିକିତ୍ସକଙ୍କୁ ମାନେ ମୁଁ ଦେଖିବା ପାଇଁକା ଏଠି ଯାଉ ଚାଲି ଆସିଲି ମୋ ପିଲାମାନଙ୍କ ନେଇ ଆପଣମାନଙ୍କୁ ଯଦି ତ୍ରୁଟି ଥିବ କିଛି ମାର୍ଜନା କରିବେ ଆଜ୍ଞା।
ଧନ୍ୟବାଦ ସାର୍, ଆପଣଙ୍କର ଆଶୀର୍ବାଦ ସବୁବେଳେ ଥାଉ। ଅଦର ପାର୍ଟିସିପେଣ୍ଟ। So, अरे you close the sessions. ଆଉ କ'ଣ କଉ ଦେବାର ଅଛି? କାହାକୁ ଦେବାର ଅଛି?
Hello. Now we'll be felicitating Dr. Jagulal Agrawal. With this, we conclude our inaugural ceremony. Now I request everybody to stand up for national anthem so we can close the inauguration ceremony. request all the dignitaries to be seated so that we can continue with our further plenary session.
To have the lunch in the dining area. There will be an executive body meeting in the PDR hall. The EC members are